and welcome. My name is Madhurija. For those who've not tuned in as yet, my pronouns are she, hers, and I am the director of the Kennedy Satcher Center for Mental Health Equity, part of the Satcher Health Leadership Institute here at the Morehouse School of Medicine. It is my pleasure to welcome you back to this 5-part roundtable series we're doing on criminal justice and equity, bridging the gaps. This series has been made possible through generous sponsorship from the WellPath Cares Foundation. From January through May, we have been bringing you a monthly roundtable to address how we as a system, as communities, and as professionals can ensure that equitable solutions in healthcare and service delivery include a population that has been historically neglected and grossly ignored from policies and programs, the justice involved. We've learned quite a bit this far in this journey about policies, about data use, about the criminalization of mental illness, and what it means to be trauma-informed. And today we tackle reentry and reducing recidivism in this penultimate part of our series. One of our biggest takeaways from our first 3 sessions has been to prioritize the inclusion of those who lead from lived experience. As such, we decided to approach this penultimate panel a little differently and spotlight a scholar whose journey to success is something we can all learn a great deal from. Before we kick that interview off, we will first return to a quick remark from our co-founder, Patrick Kennedy.
Welcome to our 4th session of the Kennedy Satcher Center's Mental Health Equities webinar series, Criminal Justice and Equity, Bridging the Gaps. I first want to thank Madhurija for her tremendous leadership there at the Kennedy Satcher Center. I want to thank all of my colleagues over there, Daniel Dawes, President of Morehouse School of Medicine, Valerie Montgomery Rice. I want to thank WellPath for sponsoring this webinar. I want to thank also my great friend and longtime colleague, David Satcher, who wrote the first Surgeon General's report on mental health and who's been an inspiration to all of us in the advocacy world. We are in the midst of fighting many battles on behalf of mental health equity. We're first trying to make sure that we become integrated with the rest of medicine. Then we're trying to make sure that as we become integrated with the rest of medicine, how do we become integrated to cultural humility, integrated to cultural competence? How do we reach out to those communities of color that have long been neglected by our mental health system? And finally, perhaps most importantly, because of the fact that all of the biggest mental health institutions in this country are jails and prisons, finally, we are now facing the great tragedy of our criminal justice system, which has really criminalized mental illness and addiction. If we're truly going to find equity in our country, we have to address the enormous inequity in the population of our criminal justice system, who disproportionately are not only communities of color, but also disproportionately people who are suffering from a brain illness, for whom there was no health system to take care of them. And so by default, the criminal justice system becomes the institution that they fall into. There are so many layers of tragedy and injustice in this current system, all of which need to be corrected. But we're so honored today to have Stephen Matthews, who has spent a lifetime really looking at how do we keep this tragedy from repeating itself. Best way to do it is to help people not end up back in prison, and of course to help people not end up in prison in the first place. We are very interested in this webinar to really focus on the things that we can do to support people that will enable them to have a better chance of avoiding either falling into the justice system in the first place or falling back into it after they've been released, but in many cases not given the tools to succeed after they are back out in society with nothing but a scarlet letter as someone is formerly incarcerated and who have very little opportunity to advance themselves and to get the support that they need in order to survive. We need to make sure that we address this problem, and we're so honored today, Stephen, to have you tell us what your learnings are working with the justice-involved population to really help us decide what we need to do to change public policy so that we incentivize support systems that reduce recidivism and make sure that those financial incentives out there are to keep people out of jail and prison as opposed to fill those prisons. We know what we need to do. Now we need to rewrite our policies in this country to do what works in reducing the enormous population that are incarcerated in our country. In fact, America, in spite of being the longest serving democracy and the leader of the free world, incarcerates on a per capita basis more of our residents than any other free country in the world. That's an indictment on us as a society. We need to correct that wrong, and I'm proud that this webinar series, and especially today's webinar, will take us through the steps necessary to see that through. So thanks so much, and hope you have a great webinar.
Thank you to Patrick and Dr. Satcher for their continued stewardship on this initiative and all of our initiatives here at the Kennedy Satcher Center. Without further ado, it is my distinct pleasure to set a stage for today's discussion and introduce you to our speaker for the morning. In 1999, in response to the elimination of college and prison programs nationally, the Bard Prison Initiative was founded by undergraduates at Bard College. After gaining access to the New York State prison system and securing limited funding, Bard College launched BPI as a pilot program with 16 incarcerated students in 2001. Since then, the program has grown annually and dramatically. Its first associate's degrees were issued in 2005 and the first bachelor's degrees in 2008. Today, the BPI College Initiative is spread across 6 interconnected prisons in New York State. It enrolls over 300 students and organizes a host of extracurricular activities to replicate the breadth of college life and inquiry. Since 2001, BPI has issued roughly 50,000 credits and 550 degrees. It offers more than 160 courses per academic year and engages an extraordinary breadth of college faculty. Much of what we've learned in this webinar series over the last 3 sessions is that reentry needs to begin before and during someone's time in prison and not just imagined in life after. And facilities need to account for skills necessary to achieve success when folks return home. We know that there is a close connection between educational attainment and employment, housing, and overall health and wellness in our society today. One of the other things we have learned is that measuring outcomes for programs is not just our responsibility to measure deficiencies in our system, but also ensure we are highlighting recovery, resiliency, and examples of strength of those who overcome so much. As such, it is my pleasure to introduce you to Stephen J. Matthews. Stephen was in college when he was met with a prison sentence at the age of 21. He was able to complete his education through the Bard Prison Initiative and graduated with his college degree in 2011. Upon his release, Stephen jumped straight into advancing his education and his career. He is now a health policy fellow and Master of Public Health candidate at the Columbia University Mailman School of Public Health. Stephen, welcome, and thank you so much for joining us today for this important conversation.
Thank you. Thank you so much for the introduction, Audrey. Thank you to all you folks at Kennedy Satcher Center for Mental Health Equity. And thank you for this platform and this type of discussion that needs to be had. Thank you so much.
For our audience, we will have time today at the end for some Q&A, so please make sure you send those to the Q&A section. We have also selected some questions that we received from the registration forms prior to today's meeting. We encourage you to continue to use the chat to respectfully engage with each other, as well as send those questions, as I said, through the function in the Q&A so we can see those. Stephen, I have had the pleasure to speak to you now a few times before we meet today, and I've learned so much from you every time. Why don't we start with you telling the audience a little bit about your experiences and what you would like them to know about you that makes your perspective uniquely important in our quest for equity for the justice involved?
So I thank you. I mean, that one of those questions when people tend to ask you. So tell me a little bit about yourself. Um, my story, is a much different story than a lot of folks. A lot of folks in our population, the folks we might meet every day. Um, I was approaching my 22nd birthday in 1993, and I was facing life in prison. I spent 25 years behind bars for killing someone. But before I even move into all of that, I just want to pause and just say that, no matter what accomplishments I may receive, as you described me as a scholar and being here at Columbia University and a graduate of Bar Prison Initiative, um, all of those accomplishments and the degrees earned in the programs that were completed, even my own personal growth, that all comes at a great and inexcusable and indefensible cost. I just want to say that, make sure that we have that out of the way, because when you're responsible for taking someone's life, you're responsible for so much more, and you're responsible for changing the lives of your family, of the victims' family, of your community, and even the people who weren't even born yet. And it reverberates throughout time. So I often say that it's much like an amputee, that you end up learning how to live life with a certain piece of you missing, but you still realize that that piece is missing. And once I came into the full realization of that notion, that was like sort of the beginning for me as I began my prison sentence. As you just alluded to, that reentry does not begin once a person leaves prison. It should and must, and often does, begin um, throughout the prison term, however it might happen. And that's for individuals who are calibrated correctly, who have the support, who are, engaging with themselves. And that's an important aspect, engaging with themselves and engaging with the world around them. So my real rehabilitation began with the notion that, hey, I need to gather up myself. I need to kind of, reintroduce myself to myself, find myself, discover myself. But I knew I didn't have the necessary tools. So that got me looking for ways in which I could actually start to engage with the world. I was in prison during a time when there was a shock wave across this country, and I should remind us that we are on the cusp of another shock wave of getting tough on crime and looking to the criminal justice system to solve, very, troubling social and public health issues. That said, there were very few opportunities for higher education, as the then governor of New York at the time, George Pataki, had just stripped away all funding from college programs, rendering them, well, there was no opportunities available. It began when I was in Auburn Correctional Facility, um, by the college program, and it was a small college program. It's just something, just kind of like a pilot, started by Professor Emeritus at Cornell University, Dr. Winthrop Weatherby, the Chaucer professor. So here it was. We were, these 4 or 5 prisoners sitting in a room with with this professor of English, and he's, describing to us how to put together compositions and that sort of thing. So it was really kind of new, and it was challenging because I thought, having had a few courses in a college classroom on the outside, I thought that I would just be fine, but it was challenging nonetheless. It made me realize that I wanted more, that I had to start to um, populate my mind and my thoughts with these concepts that everyone sometimes does wrestle with. What am I doing here? What is the best life? How do we behave as society members? Um, And it was a fellow prisoner at the time, Jalil Muntakim, who came to my cell and he said, "I see your name is on the call out." I said, "Yes, I am." He says, "You're going to that college program." I said, "Sure, I'm getting ready right now." He said, "Well, let me remind you that your education doesn't belong to you." So that was that was a challenge, and it was just like a splash of cold water in my face, because I thought I was going to get the education for myself, and I have been reminded every step along the way throughout my time in prison and even now that my education, it does not belong to me. It is something that I can use to shape, to engage with, to um, perhaps even start to work on solutions to make our world just a little bit better. So that's a little bit about me. I was kind of all over the place, but that's a little bit about me. Yeah.
Thank you. I think also, that's a really profound thing to say when your education doesn't belong to you. And there's so much to unpack there with that. I think terms like reentry, reducing recidivism, they're common language in development work, social service strengthening. What do those terms mean to you? What does effective reentry mean to you? Or when you hear those things, what comes to mind given your experience?
Well, the thing about reentry, and again, I think it needs to be stated over and over again. Um, first, the thing about rehabilitation, or just moving towards that, that beacon of light. It it has to begin before the prison sentence gets underway. Reentry, I think, is a misnomer, because prison is a microcosm of society. We are not totally cut off from society. We're in a different place. We're removed. We might be isolated, but we're certainly not cut off from society. Many of us still have our family. Many of us still have our friends. I also want to state that I'm an exception. I know this. I'm an exception. But as the honorable Patrick Kennedy just said about the indictment on our society, might be an exception, and there are many exceptions that stand with me. Men and women who have gone through similar circumstances and are, yes, very successful. Now they're here out in the so-called real world. But let that exceptionalism be an indictment on our system. The thing about reentry, and it must be understood in these terms, I usually talk about it like using the alliteration of ends, with reentry. It's the nouns, it's the knowing, and it's the network. The nouns are the persons, places, and things. As Dr. Winthrop Weatherby showed us in that classroom long, long ago about, the 8 parts of speech. We thought we didn't need it. But those nouns are very important, because that's the environment. Who you find yourself with. Where are you at? What are you experiencing? What are you seeing? Those are the things that have, an impact on a person, no matter where they may find themselves. But more so for a person who's vulnerable in prison and moving outward into the larger society. Then there's the knowing, which is the education. The education is important, but the education is 2 parts. There's an education that you have for yourself. As Jalil Muntakim said, it doesn't really belong to you, but it's an education that you have of yourself. That's the formal education. That's in the classroom. Whether you're an autodidactic or someone, who can just, you're just someone who can take in a lot of information and then use that later, or you're experiencing something that is of yourself. I've taken participated in programs like the Rehabilitation through the Arts, begun by Catherine Balkins, almost 30 years ago at Sing Sing Correctional Facility, and she brought that to other facilities. And so we were able to discover ourselves on stage. Many of us who were RTA participants. Then there's AVP, which is the Alternative to Violence program, which showed us solutions to work out problems nonviolently, or to even think about things nonviolently? How do we function in this world? And then there was Prisoners for AIDS Counseling Education, which I have the honor of being the director of a chapter of PACE at Fishkill Correctional Facility, where it was an each one, teach one, and we were allowed to, work with our peers, men and in some cases trans women who were trying to get a hold of themselves and move beyond their own personal, health, and saying that, I'm a complete human. I might be infected or co-infected, but that doesn't lessen me. And that was something that taught me that, yeah, I'm in prison, I'm serving this long sentence, but that also doesn't lessen me. It's still human, and I have potential. So that's kind of a little bit, and I want to say the last end, because that was a large part of the knowing. The knowing is really the big part, and I apologize for being so lengthy. The network is another part of the reentry. That network is very important, because that's you. That's all of you who are tuning in today, and that's me now, right? I have my compadres who are recently arrived home, who I work with, who call me up, said, "Hey, Steve," and as I said, not an exception. I'm not the only one. And they say, "Hey, I just got accepted to the government. Tell me what I need to know." And I said, "Okay, come on, let's meet somewhere. We'll go to, to a restaurant, and we'll go, to a cafe. We'll sit down." And I said, "Bring your laptop," and we just, So being part of that network of support, very important. But as a person who provides support for prisoners, you gotta walk the walk.
Yeah.
You can't just talk the talk. You have to walk the walk. You have to be steadfast. You have to be reliable. You have to be consistent, because this person who is coming back out into a world that has changed so much, they're vulnerable, and they rely on us. They need us to be steady, just as we need them to be present in our lives. So it's the ends, the nouns, the knowing, and the network.
I love the concept of nouns, knowledge and knowing, for so many reasons. One, I think too, because in healing and recovery, that is so much about, me being a therapist, that's something that we foster in our clients, right? Like what knowledge gives you the power that can help you succeed and thrive. Who is around you, what do you have around you in your environment? Those are the nouns that either uplift you or cause additional harm. And then your networks, where do you feel connected? The sense of belonging that you're talking about. I think one thing that it seems like is important to discuss too is fostering safety. I've unfortunately experienced many clients whose entry into the justice system started as children. The youngest person I ever worked with who was part of the juvenile justice system was 7 years old, and, released at 59 years old for the umpteenth time, dealt with serious mental illness. And when you're in a cycle like that for so long, it's really hard to imagine life outside of a carceral facility, which is why we thought it was really important to highlight initiatives like the one that you were able to graduate from. And so tell us a little bit about what that was like for you to get that bridge met inside prison, right? Where we have this misnomer, as you're calling it, that we say that people go away when they really don't. And what we're doing to fostering safety has to start there, right? And encourage folks before, during, and after to understand what safety can really mean. A lot of the clients, especially those with serious mental illness, struggle to be in shelter placements or seek help at hospitals, because those brick and mortar establishments often look a lot like prison facilities. And it can be really re-traumatizing for someone to have to enter a space like that again, right? Where they have to be so mindful of their sense of safety. So tell me what you think about in terms of fostering safety means if we're looking at effectively helping people recover and thrive, after serving a sentence.
Yeah, safety is at the heart of this. I had a conversation with, I'm also a public health fellow with, I think you mentioned that in the opening. I'm a public health fellow with Bard Prison Initiative, Bard College's public health program. One of my fellows had talked a lot about trauma-informed therapy, and he himself is doing this. He was talking about, and this is something that does happen often, that when you find that there's someone who is in the special housing unit, what we call the box. Oftentimes, that's a place of safety. I've seen men who have gone into the box and feel more at ease being away from the violence and the trauma that goes on, that sometimes surrounds certain people. That's their nouns. That is their nouns. Mm. So safety is when we start looking. That's why I pointed out the nouns. Safety, we have to start to pull that apart and look at what are the nouns. What are the points that are happening inside of those facilities? Who is in charge of those facilities? How do we hold them accountable? What is their record? Safety can take on many different forms. There's both the physical safety, there's a mental safety, there's a social safety, and we need to see how we're encouraging folks to feel safe. We need to provide safe spaces. Prison's not a safe space. It's inherently violent, inherently unsafe. We have to ask ourselves, what can we do to make prisons safer? It's not just making the officers safer. It's making everyone who's inside of those spaces safer. Reducing, first of all, sentences is one aspect. We send people to prison for enormous amounts of time. I mean, it's an incredible phenomenon that we take someone, and it's very arbitrary. We'll just throw them on. It's very easy to throw people away, unfortunately, in the common spaces of our discussion. Our larger community often, these are the smaller discussions that we have, but these are, the discussion we're having today, but we need to have them in larger spaces because we have to challenge that kind of notion that people can be thrown away. When we start looking at the fact that we can start throwing people away, it means that we can easily harm folks as well. We can make them feel unsafe because we already made them feel less than. Right. So, I don't know if I'm really answering the whole bunch, but it's something, because it is something that touches me, and I've experienced these kinds of things. So it's almost one of these things where you want to say it all at one time. But.
No, I think you're saying so much that's really valuable, and what's most valuable too is providing perspective. We've had such a unique audienceship for this specific roundtable because I think a lot of folks have realized how much criminal legal issues affect all of us, right? Even just as community members who are seeking a way to either reform the system that we have through our electoral process and voting. That's been one of the big things that a lot of our panelists say is one of the first things you can do to create safety is to vote to ensure that safety exists in your communities. But the other part of this too is people want to know what they can do. So, in taking that safety question to you, do you have examples? And I want to highlight positive experiences for a reason, because I don't want to perpetuate inequity work. What we do is this idea that we have inequity because populations experience deficiencies and as a result don't have clear pathways to succeeding. Some of our charge in equity leadership is to ensure that we highlight resiliency and strength, right? Which is why our interview with you today was really important. So what I want you to think about is if you have positive examples of folks who were able to influence you positively, and even if it was while you were incarcerated or shortly after, who helped you actually see that there was hopefulness that you could restore in yourself, right? I think that's a really important piece. And if we can highlight examples of that, the more it helps people understand what they can do better.
So Um, First, thank you, and I think that's a great question. People, people who helped me along the way. First and foremost, this probably get a little emotional for me, so excuse me before I say it. It's my mother and father,
Yeah.
Hilton and Penny. Your family, those folks who, they literally they literally gave me life, and at the same time, as I was going throughout this, very difficult time for them, they were there, like they gave me a reason, like that was the hope, you know, whether it was the phone calls, the letters, the visits, packages, what have you, they were there in every facility that I showed up. But as I mentioned, Dr. Winthrop Weatherby, Jalil Muntakim, Catherine Dawkins, Sean Pika himself, Justice as well, formerly incarcerated. I think of these folks. I think of them as being, the kind of examples. They're exemplar of what we can do. But someone who that I don't often talk too much about, his name was Red Leon Williams. He told me a long time ago, just shortly before he had passed away from brain cancer. He said, doing bad ain't a lifetime thing. It's just a temporary setback. Just like you weren't always doing good, you're not always going to be doing bad. You got to ride this out. This is life. You got to make the best of it. How you going to do it? You going to do it lying down, or you going to do it standing up? That was a charge to me. That was something that invigorated a sense of like, just like, yeah, that was the pep talk when I was feeling most low in my life. I named those names because naming those names is important for me, because it reinvigorates that sense of duty for me. As I told you once, and I know that it was corny then, it sounds corny now, but I told you about, I said that I'm a unicorn. I said that I'm a unicorn, and I said in order for unicorns to exist, my 9-year-old Zoe will tell you that someone has to believe in them. Those are the folks who believed in me. Those are the folks who believed in others, and they believed that this was not us just doing bad. It was a moment where we were just at, and we weren't just always there. We had to ride it out, and it showed us different ways to stand up. And the men that I was fortunate enough to be around, who educated me, and I'm talking about my fellow prisoners, who educated me much in the way that some of my professors here at this venerable institution, Columbia University, educated. So yeah, I hope that, again, I hope that's answering the question, because it's important that I name these folks and just, to pay homage to them, and just to say, just to say thank you, because without them, I wouldn't be here, and without folks like them, and many of those folks who I mentioned were exceptions, we probably would. They probably also would.
I think one of our commenters just kind of stated what I wanted to say too. One of our attendees said that the worst thing that we have ever done is not the entirety of our identity, and I tell clients that all the time, that the worst thing that happened to you, or the mistake that you made, or something that you decided to do one day that you regret, doesn't have to inform your entire life. And I've been, I get this question a lot myself too, Stephen. How do you keep yourself going and advancing equity as a practitioner, as a leader, when it's really hard and you have so many things up against you in a lot of ways, and also we're representative of the communities, right, that are most affected by this. And I think because we do want to speak about this from so many different lenses, one of the things that I always used to hear kiddos say is, well, my parents always tell me don't become a statistic. And, in public health, statistics drive all of the things that we make decisions on. They are policy-based, they are evidence-based. The data that we have is important. you have some interesting ideas on how we can bridge some of that connectivity. So we can ensure that data really supports someone through a life course. What it means for someone perhaps to actually get access to healthcare when they're incarcerated and then be released to a community and really be left to their own devices. I think that's something that we've been talking about a lot in this series as well. And what do you think we should be doing better of measuring so that those outcomes continue to sustain themselves positively? Is there more that we need to capture? Are there other agencies that need to be involved to help, support someone? I think one of the things I've heard you say previously is around monitoring and ensuring people have the support that they need when they're released. So tell us a little bit about that, from your public health perspective too, about what do you think is important?
Well, I think, that's another great question. Every time we talk, you have these great questions, great ideas. So, as you just alluded to, monitoring, oversight. We have to have a way in which, as Patrick Kennedy talked about, our carceral, system is the largest mental health system in the country, and that needs to be addressed. We need to find ways to monitor, monitoring with some not just the kind of I almost it's almost like a mall cop. I see you, with the flashlight. I see you over there. And nothing's done. People just scurry away, and no one's ever held accountable for their acts. Um, we we need to look at um, how we can fix those problems and make those fixes um, lasting. There's some fixes that happen and say, okay, we'll move, we'll do this, and then 5 years later we're back to square one again. Inside of these facilities after a report is issued and that sort of thing. So we need monitoring that has some enforcement behind it. The other thing I would say is that as a public health professional, this is important. Is how do we find those numbers? How are we looking at those numbers? We need to have a standard of reporting. Folks who leave prison every year, the number I think is like could fill up Yankee Stadium 11
Yeah.
times over, right? That's a lot of people. But for every person that leaves a correctional facility or a jail, that's just how many different kinds of ways in which their issues, whether it's a health need or mental health support need or some survival need, is described to someone else. So it's all over the place. The way in which we collect data on folks inside prison while they're incarcerated needs to be standardized. It's all over the map. So we need a standard way in which we are collecting this data. Because if you go to New Jersey, right across the river from me, the way in which they collect data in New Jersey is much different than the way they collect it in New York. The way they collect data in Schuyler County jail is much different than the way they'll collect data in Rikers Island. So we need a standard way in which we're collecting data, because data, as you know, as many folks who are joining us today will tell you, data it tells us more than just numbers.
Right.
It tells us just more than just numbers.
I think one of our registrants asked a really important question, and I think it's a good segue to this too. Is do you feel programs like parole and probation are effective? I think we also have a lot of interested folks who are interested in something called assisted outpatient treatment, which is legally mandated behavioral health services for folks who, under decompensation risk, are at risk to themselves or to others. And sometimes all of these laws have been named after someone who's unfortunately been killed by someone who is psychiatrically unwell. In your opinion, do you think they're effective? I know New York State has put an emphasis on something called supervised release, which to our audience members who may not know, that's not in all states, but supervised release is an effort to kind of bridge that gap where someone may need to be supervised upon release in order to make court appearances, but is also met with a lot of psychosocial support services, case management, access to various things to help. The idea is if we don't offer these things to someone, they don't have an opportunity to even make those appointments, and missed court dates can end up accumulating to a sentence that was undeserved. So tell me your perspective, what works in that kind of a mindset. If someone's released on good behavior, for example, and says, well, we'll release you on probation, is that helpful?
Well,
yeah, go ahead.
No, as you just described, I'm just saying a short word, and this is probably the shortest answer I'll ever give you if it works. No.
Yeah.
No, does not work. It's not working. One of the problems that we have, and it's just one, I'll give you an example of Executive Law 259J. They can literally insert inaccurate, harmful information into your record, use that information to make a determination as to whether or not you will stay on parole or not. The decision of that is not appealable. The decision is made on purposely erroneous information is something that you cannot appeal, right? So that's an example of these quirks in the law. Just imagine that we have a portion of our judicial system that does not allow for an appeal of a wrong decision. Imagine it. That happens all the time, especially here in New York State. But to answer the question of how many people it takes to supervise this one person, you just talked about it, having a case manager, having a probation officer, having a clinician, having someone else there, all of these different pieces going on at one time. But there's failures nonetheless. So one of the problems, that we have and I just spoke of that about accountability and oversight. There are too many. There are not enough folks to do this work. It's not a criminal justice problem, as I said before. This is a social problem. We need more social workers. We need more clinicians. Mm-hmm. We need more folks that are out there that are community health workers. Because many of these people who are, many of us formerly incarcerated have health needs that get in the way of not only our, daily activities, but get in the way of us being able to perform, whether it's on the job or in school. And so we need healthcare. Right. We need mental health support. And unfortunately, parole and probation, even though there's a lot of pressure on them to do things differently, and there's been policy changes to make sure that they do things differently, they are not well equipped to do those things.
In the workforce issue, we're dealing with one of the largest clinician shortage we've ever had in the history of the United States. It's for so many different reasons. Obviously, COVID-19 as well dismantled and fractured our healthcare system, and the burnout levels of fatigue and inability to just really feel like those of us who were on the front line during that period, are still recovering from, because we don't believe that this pandemic is still unfortunately over. But I think, if we dig a little bit deeper too, in terms of workforce, what kinds of things do you think people need access to? So for example, I think in the equity field, it's always there's a blanket statement that people say is cultural sensitivity training. And often I will say, well, what does that mean? Right? Because culture is so different for so many different people. We break down outcomes for people who are incarcerated. We know people of color are disproportionately more incarcerated frequently than those who identify as white. You break it down even further, that outcomes for folks who are members of the LGBTQ plus community incarcerated end up frequently in suicide and self-harm risk. The same goes for those who are disabled and need access to certain accommodations in prison that are not met for them. The experiences of women and mothers that we learned about in our last roundtable, Andrea C. James doing this work out in Boston to really uplift those experiences and ensure that those needs are met, is what would equip a workforce to be able to be sensitive to the needs of those who were formerly incarcerated or experiencing incarceration. In your opinion, is there an effective training? Are there things that people can do more of to acclimate themselves better to those experiences?
I think it comes down to stigma. We do, and even the folks who are the most well-meaning folks, right? Their heart is in the right place. They're moving in the right direction. They still approach folks who have mental health needs, folks who are criminal justice involved, folks who have been through foster care, folks who are, fill in the blank. They approach them as if they are deficient in some way. They're lacking in some way. And it sometimes it operates in in very, muted ways. It doesn't really, it's not as clear to, just a common onlooker that this is how they're functioning. But I think there's a stigma that functions, within the relationship that, the person who's providing support, the person who needs support, and it almost comes off as, look, you need some help. You're broken. And it can be very alien. I think first and foremost, and you did say about cultural competence. Cultural competency is one thing, but even amongst folks who are in a quote unquote light group, have these kinds of things. One who carries the privilege, the other one who might be so-called diminished in some way, right? That happens. And it's what we need to do about our self-talk. How are we thinking about this person? How are we behaving towards this person? Am I being, am I coming to the table with some, I don't know, something that might be, I use the word obnoxious a lot, something that might just be obnoxious to that other person? Or am I, being open? Am I listening in a way that this person can really feel as if they're being heard? Oftentimes, as I mentioned, folks who come out of prison, they're vulnerable, and they feel like that they are quite possibly a threat, and we're looking for support. And sometimes when a person gives us that kind of look, it can be hurtful and off-putting. But I don't know if there's any hard and fast way of correcting something that has been ingrained in our society for so long, because it has an effect. Prison has an effect on those who are incarcerated and those who are not incarcerated as well. So there has to be some sort of approach that centers healing on that, both the person who's been incarcerated and the person who sees the person who's formerly incarcerated.
I think too, it speaks to the idea of, one of folks who've started following our work here at the County Satcher Center is uplifting the voices of the invisible. And what does that mean? And one of the things that we pride ourselves on here is ensuring that the platforms that we create and facilitate at the Kennedy Satcher Center includes diverse and inclusive speakership and leadership. And, we benefit from being able to have someone like yourself come and have a spotlight for us, which I think is really important. But one of the things too that I'm hearing that you might be referencing is also, cross-sector collaboration. So again, another big public health buzzword that we hear a lot. And it sounds like, even an initiative like the Barred Prison Initiative was an exercise in cross-sector collaboration, right? It is to say that we see that there is a marriage between education and our carceral system. And we need to find a way to bridge those gaps, and so that's one. But, what's worked in your mind beyond just education to create that kind of environment? Who needs to be at the table to help improve outcomes so that that healing that you're talking about, that mutual healing, is truly felt on all sides who feel affected?
Well, a good friend of mine, Jarrell Daniels, has been doing this work himself, formerly incarcerated, justice involved, young man who will be graduating from Columbia University this spring, along with myself. He brings together youth and individuals who are, the quote unquote marginalized folks, and brings them to the table with district attorneys and judges, and has them work out policy solutions that will address their lived experience. And I think that's one step. When we're bringing people to the table, because many prosecutors, they are immersed in their work, and like many of us who see horrible acts of violence, might have some visceral reaction to it, and they go to work. They go to work, head down, grind it out, focused, and not thinking about the reverberating effect of their own decision making. When they can take a moment to pause and listen, as I just described about listening to other folks who say, this is what we need, this is how we might avert a crisis. Another friend of mine, he spoke about how our mayor removed workout equipment from certain parks, throughout the city, right? And he said, you removed a safe space. You removed a space where the older men in the park could speak to the younger men in the park. And that's another thing. So we're talking about urban planners. We're talking about community activists. We're talking about law enforcement officials. We're talking about formerly incarcerated. We're talking about folks who have substance use issues, right? And all of these people have a story that they can share, that, a piece of a story that they can share to make a larger book on our community. But not just the book, but how we read that book. How do we turn those pages? How do we stay, on the page and not, and not push people out to the quote unquote margins, But I won't beat the metaphor up too much. I think the understanding is well understood that more people need to be brought in. So we're not just talking about folks, in the clinical field, or folks in public health. We're talking about financiers, right? Because some of these men and women have fantastic ideas about how to start businesses that will support those individuals who are, similarly situated. They need some money, microloan. Some folks might need a microloan just to stay in their home. We saw that. We saw how well that worked throughout the pandemic. A little bit of money will go a long way, but a little bit of money is not the only thing. A little bit of support, a little bit of time, a little bit of compassion makes all the difference in the world when we're talking about making inroads into a safer community, a more inclusive community, a community where everyone feels involved.
And a reminder to our audience too, next month, is our culminating roundtable, and I'll give some details about that in a little bit, but we are tackling housing access as a primary issue for building support for folks who are formerly incarcerated. And that is, like, if you don't have a place to live, one of the biggest themes we've learned is how can you make all of your appointments? How can you ensure that you're accessing your healthcare? And what does that really look like? And I appreciate that you acknowledge too the importance of including law enforcement in discussions about what works and creating safe spaces for those. Here at Kennedy Satcher Center, one of the things that we're starting to look at is ensuring that equity is embedded into 988. And so I'll remind people who don't know what that is. July, we will go live for 988 will be a psychiatric emergency line that replaces 911. So when someone's in crisis, the theory is that they will get a mobile crisis team dispatched to them as opposed to a law enforcement response, hopefully to reduce fatality and incarceration. But one of the things that we think through is, in parts of the country that are extremely resource deprived, very rural areas in the United States, we have to utilize some of the existing structures are there. And how do we more effectively do that? And last month we were lucky to witness a conversation between Andrea, who's formerly incarcerated and a leader and an activist, and the sheriff of Nashville, Darren Hall, come together and actually see consensus, that what we're doing to support people needs to be arresting a problem and not a person. But Stephen, from a policy perspective, if you could think of one legislative need, that we could change, if you had your ideal, this is the button I push and we've changed this legislative policy that would really just eliminate a lot of the barriers that we've talked about, what comes to mind for you for folks who are justice involved?
Lifting qualified immunity.
Tell us more about that.
I know that's not often a public health type thing, but lifting qualified immunity keeps everyone involved. Now, qualified immunity is another quirk in our jurisprudential, landscape. It's one of these things where if you're a district attorney, a police officer, a corrections officer, and you're doing something in the line of duty or within your field, whatever action that you might have, you will be insulated. In a manner of speaking, you'll be insulated from any kind of lawsuit, even to be indicted. You are doing this. Yeah. We need to lift qualified immunity because and the reason I said keeping people honest, because I can't tell you how many men I've served time with who served time that they should not have. Mm-hmm. They spent time in prison that they should not have. We hear these stories all the time, but what we don't hear is how a district attorney was brought up on charges for his misconduct, or how a police officer was brought up on those charges. And this isn't to cast aspersions on law enforcement. It's, again, to keep everyone honest. We need to make sure that folks are doing their job. They're doing a job in our name. They're doing a job that we've asked them to do. They're doing a job that, yes, that sometimes we need them to do. But sometimes they're doing a job that they're not asked to do. No one has asked this district attorney to withhold exculpatory evidence. No one asked this officer to put his hands on this individual and hold them down. No one asked this correction officer to deny this person medical treatment. We didn't ask them that. So we need to lift qualified immunity so we can get some of those things out of the way. That removes, folks from the opportunity to do harm to people. Right? So I know that's not so much a public health question answer, but it's an answer that I think, given this platform today, and given the fact that I still have compadres in harm's way, that I owe it to them to speak to that, and to make sure that is something that is just thought about.
I think that is a public health answer, right? Because what you're talking about is the health and safety of people and ensuring that all of those who are supposed to be who are supposed to be responsible for caring and ensuring that individuals are met, not just health providers. You're right. And I think, at your discretion, you've spoken to me as well around just seeing how much safety was taken advantage of, at the hands of folks who worked in carceral facilities, and the type of harm that you were witness to. And from a behavioral health perspective too, what we say all the time is a lot of folks don't go to prison with a mental health diagnosis, but certainly may leave prison with things like traumatic stress, anxiety, depression, full-blown post-traumatic stress disorder, in addition to other types of things that can be induced there. But I don't want to ignore too, a lot of our registrants asked about the experiences of youth, and when we talk about reducing recidivism, part of that is, again, what happens before someone might be incarcerated and tried as an adult. So tell me a little bit about your experience, but maybe also what you think needs to be prioritized for youth, so that we can ensure some of the things that we see are cycles that are intergenerational in families don't perpetuate, but also that we have these stigmas around certain communities in the United States, specifically poor brown and Black communities, especially. But I want us to be able to focus on youth too, and ensure that we're addressing what that looks like to support youth as well, to do well.
Right. I think the conversation that we need to have with youth, first of all, is important, especially when we find that they are in places where, are not designed for children, for young folks. Prison is not the place to be putting, a 15, 16-year-old, 17-year-old child. It's just not. I think that when we talk about our youth and what they experience inside of these facilities, they need to be, first of all, those kinds of facilities are not meant for them, and so we need to remove them from those facilities. We need to make places that are safe for them, that are truly, and I hate using the word, I can't stand using this word, rehabilitative, but things that give them purpose, hope, and meaning to their lives. When I was the director of PACE, I was asked to go to the school building every Friday, and I spoke to thousands, and literally thousands of young men and men some my age. But it was the young men who I was looking at most specifically, the way in which men like Jalil Muntaqim and Lumumba looked at me, right? And Jerry Glossner, these men who looked at me, guys who had these 70 numbers, who've gone through Attica, and they were looking at me with the same hopeful look that fathers sometimes look at their sons. And I would ask these men, I would ask these young men, I would say, what's the most important thing wherever you find yourself? What's the most important thing here in prison? You get all kinds of answers. And I would say, you. And it wasn't that I was asking them to be selfish. I was asking them to be self-aware. And we're not asking or placing our youth who find themselves in these situations. We're not allowing them to look at themselves as beautiful, as with potential. And so I think that when we start to look at the way in which we organize our youth offenders and putting them and organizing them and making sure that they're not out, we need to start looking at where they're living.
Yeah.
We need to start looking at how they're being schooled. We need to start looking at how they're being fed. We need to start looking at how they're actually living. That's the first approach, right? That's the first approach, because where you live, who you live around, what your access to proper nutrition, to support systems, to recreation, the built environment. You look at places like Mont Haven, the Bronx, And then you go down and you look out and you go out to Long Island and you do a compare and contrast. You know, the green space ratio, right? And it's something that I talked about with the professor here, green space ratio, meaning that there's how much concrete and blacktop there is to green space, meaning trees and grass and that sort of thing. The green space ratio in the Bronx is so much lower than the green space ratio in other areas, other counties, even a county that I grew up in, Chemung County, right? But that's not the whole solution. These young folks need access to education and opportunities that they have been denied. And again, when we find that they're in an institution, that's not the place for them. They need a place where they can be who they are, where they can really answer that question. If somebody asks us, they can answer that question and say, me.
I think, what you're alluding to too is like what you see around you influences how you feel about yourself at a very basic level. And that means so many different things around green space. I worked in Washington Heights, Manhattan for years as a community clinician, the largest clinic there that's bilingual serving. And I will never forget the day when we had the unfortunate mass school shooting down in Florida, and the students so beautifully organized, for themselves. We're marching, we're walking out, we're going to Washington, D.C. We want to stop gun violence in our schools. And they organized a national school walkout. I don't know if folks remember this in our audience. This was a couple of years ago. And I remember the high schoolers that I was working with, who were going to the inner city public schools in New York, would come in and say, well, we were really excited to walk out. And no one cared that we were walking out. I said, what do you mean? And I said, well, only a handful of us actually walked out. Some of the students used it as an opportunity to just leave school because they didn't like being in school. And people don't realize that we experience violence in our schools every day.
Yeah.
For this is an everyday experience. Going to school, you have no idea what you're going to walk into, right? And it was heartbreaking for me at that time as a young clinician to hear a child say, why don't people care about our school violence as much as they care about their school violence? What do they have that we don't have? So this can't be an equity discussion without also talking about some of the things that some of our registrants really were curious about your opinion on too, is that sentencing does not look the same for everyone. And punitive responses do not look the same for everyone. We do know that we just have a history of discriminating against men and women of color who are met with a carceral sentence, and that sentencing or that punishment that they receive is often not the same. Right. And yet we struggle to actually find the evidence that can prove that beyond just saying, look at the numbers, right? We can say that we know that this many people of color are this much more disproportionately long-term sentenced than people who identify as white. So, in your perspective too, what are the questions that people aren't asking, right? Like, what are we not saying in terms of ensuring that those kids feel like their school violence is just as important as everyone else's school violence, right? Or what are we not saying that people need to hear, that this sentence that you're talking about, someone going away for a very long time who doesn't deserve to do that, compared to someone who might deserve to actually go away for that long, right? What people deserve is subjective. And I guess what we're also arguing in this roundtable is that our criminal legal system cannot be subjective, and yet it is.
And that is probably one of the more troubling aspects of when we start talking about data collection. We start talking about association. We start talking about things being statistically significant, or practically significant, right? They don't matter when you're seeing numbers with your eyes. And you're feeling those numbers with your heart. You're feeling them with your experience. The problem that we have right now, we're in this moment where we just don't have the ability to see people as we see ourselves. We don't. How can we get to a place where we are not marginalizing folks? How do we get to a place where we are giving everyone the same kind of opportunity? Not the same kind of outcomes, same kind of opportunities. It's much different talk. When we start looking at our policies, how we share information, how we organize those policies, how we make those recommendations, we need to do so with a complete understanding that there are folks at the other end. Sometimes we do this often by looking too much at the data. And, I fault some policy wonks. I'm probably, one of those folks who would be, somewhere down the line accused of this as well, that we look too much at the data and not at the, the actual outcomes. But I think that is where we, I think we need to start making, a greater effort, making sure that everyone has, has a place in terms of the organization of our policies. There was another part of your question, and I want you. It was the last part of your question. I'm sorry. You did ask another thing.
I think you're speaking to it actually. I'm just saying so that we ensure that what are we asking, right, in terms of sentencing to make sure that people are seen equitable in terms of the crimes that they commit. And I appreciate that we have a couple attendees who've honored, that you are acknowledging your respect for the victims, and that your responsibility for things that you've done. And what they're saying is part of the way that you're honoring that family is by doing the work that you are, to call upon attention to these issues to ensure that these things never happen again.
Yeah. And thank you for that. I think that, we start talking about this idea of restorative justice, see our justice system is built too much on vengeance. It's the old ancient belief of lex talionis, of an eye for an eye, right? And I think, I don't know if we engage in a discussion on it. There's certainly not room for today to talk about that. But, I remember reading Aeschylus and the Aristia, right? And it talks in this end of this three-part, series of this play, talks about mercy, right? We don't have enough mercy in our judicial system. There are four things that judges often consider whenever they sentence an individual. It's isolation, deterrence, and retribution is the first thing. And then the ability or the possibility that this person could be rehabilitated. We spend so much time on the first thing. Where all of our money goes, all of our energy goes. It's, we only had just this last, part of, actually this first part of this. Actually, I think the summer 2020, really kind of put a spotlight on the fact of what we need to do to make us a more complete society. How do we look at ourselves? And I think in that fourth one, when we start looking at how in this person's ability to rehabilitate, that's not just saying something about the individual. It's saying something about us.
Right. I want to take an opportunity to see if any of our attendees have questions. We do have one that's come in, which is a really interesting question. And so I'll ask it, but I will also say up front, I don't know if this is true for every state in the United States. It may be true for some of them, but I unfortunately don't know the answer to this. But the question is, don't parolees also often leave prison with a massive bill because they are expected to pay for their incarceration? Even though the work they may do while incarcerated could pay 25 cents or pennies an hour, depending on the facility, how can anyone rebuild their life with that hanging over them? And I think if we can broaden that question, Stephen, your take on just discharge planning, right? That concept of discharge planning, how many people are released with nothing, no identification, no insurance, no money to their name, nothing at all. And then to speak to this, if you also have other bills that you have to pay in the midst, what works and what doesn't.
Yeah. I was in a panel discussion. We talked about this very thing about when a person is preparing to leave prison, right? having documents, having information available. Just real quick, yes, that I think that is a jurisdiction that sounds very much like Arizona. I'm getting Arizona vibes from that first part. It sounds very much like that. Um, the harm that's caused, and I'll say that, and that is in relation to just saying that really, really briefly. I don't mean to digress too much on that, but the harm that's caused as a consequence of a prison sentence isn't just the emotional, the physical, the mental damage that is caused. There's also financial damage that's caused. Something that continues the cycle and does not allow a person to gain a foothold on success, upon reentry. So I'll just say that prison, yes, from the gouging of the price gouging for the telephones that your families call, to just packages and all of these things. The transportation. They got rid of the free bus program. They used to have a free bus program in New York State that used to different parts of the state, and they got plenty of money for more jails, but they got rid of the bus system. That would transport family members to facilities throughout the state of New York to these facilities, and you could have time with your loved ones. But I want to just get back to the thing about and I'm forgive me because I just lost my train of thought. What was the question?
The person was commenting on what does it mean to have, a bill like that hanging over your head, and I broadened it to just be exiting a prison without really anything to your name at all.
Forgive me for losing my thought. The thing about something that you alluded to, and it was more geographic, and that is when a person leaves prison and comes to New York City, there's an enormous amount of help. There's large networks. Yes, people do fall into the cracks. Yes, we can do better as a city to receive our returning New Yorkers. But I'm a New Yorker from the larger part of New York, from upstate New York, right? And what does reentry look like in those regions? You talked about rural versus urban. I think you alluded to that a bit and what that means. When someone is coming home, right? And kudos to Albany, to Governor Hochul and the rest of those folks who made sure that they got rid of the supervision fee. Because there was a supervision fee that you had to pay while you're on parole, right? How are you going to pay a supervision fee when you don't even know how to get any money, right? That's a problem. But where someone is going to live is another issue. It is the larger issue, something that you talked about earlier today, and that is another aspect of folks not having the money because you need money to live someplace, or you go into a shelter. But what happens if those kinds of places are not available where you might be returning to? There's another thing that I think that we also need to think about too, and this goes back to one of the previous questions about policy changes. I did discuss, and I did say qualified immunity. We need to stop returning people back to the county of their conviction. Let me say it again. We need to stop returning formerly incarcerated folks coming back to the county of their conviction. That's very important.
Okay. Can you expand on that a bit? Why would that be beneficial so that we can understand? I can understand, intuit.
There's a Russian proverb said that you should never return to a place that you are the happiest. Well, if that is true, you should never return to a place where you were the unhappiest. Or, you're coming back into an environment. Yes, there might be family there. Yes, there might be. But in many cases, we have a graying population. We have men and women that have been serving time in prison since the 80s. And now they're coming home and they're in their 60s and 70s. Many of their family members have gone, who moved away,
right,
passed away. You're sending them back to a community that is like sending them to the moon. It makes absolutely no sense. And then you're sending them to communities in many cases, in some cases, that it's deplete of the kind of resources that they need as older folks now.
I think also what you're acknowledging is that this is a family unification challenge, right? If we see this as a family issue, that an entire family is affected by someone's prison sentence, perhaps things like this would be considered. Are they going back to the same place that they return? And there's this whole, comparison often people make that returning from prison is a lot like returning from combat, right? Where you come back home sometimes if you've served multiple deployments, your home doesn't look the same. Your home doesn't look like it used to. A lot of folks account for suicidal ideation in combat veterans who are coming back to their home communities and appropriately attribute it to, intrusive thoughts and memories of things that they've experienced in war. But sometimes the lesser parts of what we talk about is that there's evidence that shows that suicidality may be on onset because their spouse may have moved on with someone else. Or their kids don't recognize them because they were infants when they went away. And they come back now and they're trying to make an effort to be a parent, for example, and they can't. And those things are not removed from someone who might be incarcerated as well. The last question we'll take here before we close and then give you an opportunity, Stephen, to maybe say something final is this attendee said in Wisconsin, the prison system is called the Department of Corrections. Why is it that after time is served for crimes, individuals are treated as they have not made corrections in their lives and still being punished by society and laws that strip them from their rights and humanity? And I think that statement is really important in terms of several panelists have talked to us about language choice, the words that we use to describe the experience of being incarcerated. So to this point, saying calling it corrections, that we're correcting wrongs or things that we've done, and yet you're not seen as somebody who's been rehabilitated, right? That's another one that we're saying. Several people in our last panel acknowledged the use of the word inmate should be eliminated. That's something that we can't use anymore because it's so stigmatizing. The question Chloe asks here is, are there current successful reentry programs and that reduce recidivism? Policies, can we support this? That's a great question. I do encourage you also to just check out some of the previous panels we've had, Chloe, as we had some of the representation from some folks who've had those programs. But Stephen, to maybe what helped you, was there a program that you graduated to, when you were released that was helpful to you in New York that you could highlight, in addition to the BPI initiative, obviously was part of your life, that you were attached to that you think did a great job?
Right. Well, in addition to the work that BPI does, and they've done the work inside of prison as well as creating this bridge to the outside of prison, right? Whether it's mentorship, just creating a network of support, that sort of thing. So our prison initiative, as founded by the executive director Max Kenner. I mean, go Google Frontline, use Frontline Bard College, and it'll tell the entire story, everything that you need to know, what makes that successful. But also the Hudson Link. Hudson Link is like a consortium of colleges and universities that all come together in different facilities, mostly in the Hudson Valley region. Obviously, Sing Sing, where I was in Fishkill, I graduated from one of the Hudson Link college programs, Nyack College, where I got my undergrad in organizational management, Sean Pika. But upon my release, we were sent information, here's your packet. When you come home, this is what you can do. You can come to our offices. And I was given a laptop, an old refurbished laptop, clothing, that no longer fits because I gained so much weight since I've returned home. But, we were like, it was like you're coming ashore and someone's putting this blanket around you and getting you dry. And so it was like that first time we sat and we had lunch, and it was just like, set up an email, then there's all this other help along the way. So, but that doesn't exist for many folks, and I understand that, and we need to make that a wider experience for folks to enjoy. So the Hudson Link was very integral to my first first step on dry land, so to speak.
Fabulous. Well, unfortunately, we are out of time for today. Stephen, I sincerely thank you for joining us. You were very honest and very candid, and you have so much knowledge that is obviously personal, but you've taken it on to also take it on professionally. I thank you for truly being a champion of equity in your role in this movement. You have done so much already, and I'm very excited to see what you continue to do. To our audience members, our last culminating roundtable in this series is next month, 1 week ahead of the anniversary of George Floyd's murder. Also, it is Mental Health Equity Month. We've renamed it over here at the Kennedy Satcher Center. We are so excited to bring you some special panelists who include the CEO of Mental Health America, Schroeder Stribling, Executive Director of the CROP organization, Tara Lawyer Harper, Senior Consultant and Co-Founder of Physicians of Criminal Justice Reform, Dr. Sarah Vinson, and Executive Director for Business Development at the Gateway Foundation, Alexis Rosales. This culminating panel will address a recurring theme we observed through our series and fittingly address housing access and environmental support for those who are formerly incarcerated. You won't want to miss it. Please go to kennedysatcher.org to register. That concludes our roundtable for today. You will receive a post-event survey that we really hope that you continue to complete. It helps us improve our programming as we incorporate your feedback. Be sure to follow us on Kennedy Satcher on Twitter and the Satcher Health Leadership Institute account on LinkedIn for updates on who our speakers will be and how that programming evolves. More than anything, I wish you all health, safety, and wellness as we push onwards on our quest for equity for all. Stephen, thank you so much again, and we look forward to seeing you soon.